Okay?
We kind of did just the opposite, so we gotta go back. And so the Sartorious laterally rotates the hip, AB does the hip, flexes the hip, and immediately rotates the lower leg when the knee's flexed. So we put her in this position, which is opposite of all those, and then we had her try and bring her leg back into medial rotation, which does the opposite for the hip, and we try to keep her hip in an extension a little bit. You could also do this in prone, I think. So, okay, go ahead. Okay. And then put her out a little, oh, sorry, put her out a little farther. Go ahead. Okay. And then take her farther. I guess you would require this one, or block the knee on the lateral side.
If you block the knee on the lateral side, you help prevent what type of abduction at the hip? AB, which is good.
Okay.
But you brought up a very, very, very good point. Anyone catch that? Chris?
It might be better off with prone.
Ah, prone. That actually plays a role in just what we saw a moment ago as well. I'm going to wait to see if it came up here. So show us what you got.
Okay. So we did it. Right?
Familiar?
Okay.
And the Kamala test, this test itself is also stretching the Sartorious. Okay, Kamala link test. What we're doing here is getting the Sartorious into play. Now, if we back up and take a look at what the last group was, they were what again? The TFL. Now you guys have to show me TFL since you're up here. I'm going to call it the other group. How would you do TFL?
So that would be the opposite of this Sartorious.
Yep.
So if I was prone, I guess like I would just like out of the way as much as I could.
Yeah, that's fine.
Just like that, and then after.
And you'll see a lot of times too, people will be working with their elbow down here
Oh, that makes
to
sense.
provide the resistance, and they might be doing some soft tissue work in the area of the lateral side of the knee, curvitustical and whatnot as well, to try to go ahead and get some of those tissues a little bit more pliable as well. Okay? But again, doing it that way, what's the difference? What do you notice as far as body mechanics in this case?
It's easier for the PT, I think, when they're prone.
Yeah, I'm letting gravity kind of come into play here. I'm letting, you know, the fact that my body weight can be used as a resistance. I don't have to do a lot of work, and I also can use the ability to kind of free up my hand. So that's something that, you know, you have to kind of consider too. Whatever kind of works. Can everyone get prone? No, a lot of people can't. Okay, so you have to keep that in mind. Who was the other group on this? You guys come up with anything?
There was one stretch thing for home exercise where you would actually just go in position and push down like under resist yourself.
Okay, so Matt is saying to kind of come up right here. We'll just kind of come on up and show.
Oh.
Well, no, we'll let Matt show us, okay?
Oh.
Just want you to be short sitting. Kind of on a chair.
Is it your chair or
Sit in a chair.
Or down here too, either way. That's fine, whatever works.
And then you would just kind of cross, like actually put your, like, it's fine. And then you kind of would just push, actually, yeah, you would, I think you would just push down.
Okay, Matt's bringing up a good point here. Okay? He's on to something just a little bit on a tangent here, okay? So, you're trying to what? Stretch what muscle here? Sartorious. What does Sartorious do? It's also called sometimes, I'm sure Art told you that, it's the talar muscle, and it actually does this, right? So is this stretching it or making it, yeah, making it short, okay? So it's actually just the opposite, but what happens sometimes? You can have people who have a short TFL, very common, and no problem with the Sartorious. You may want to try to do some stuff to strengthen the Sartorious to provide that balance, because What's the difference there? One's a medial rotator, one's a lateral rotator. You might want to try to shorten the sartorius, work it in the short position. And in that case, what you did is exactly it, right? Because you put the muscle in the shortened position, ask for a contraction, and what does that do? Take a muscle, put it in short position, constantly use it in exercise format there, it should what? Start to